I am so excited to present the results of this study called Physical Therapy in Women with Early Stage Lipedema, Potential Impact of Multimodal Manual Therapy, Compression, Exercise, and Education Interventions. This study was performed by Dr. Paula Donahue and her team. Dr. Donahue is a physical therapist and a certified lymphedema therapist, and this study was published in the Journal of Lymphatic Research and Biology in 2022. There has been an incredible amount of research and growing understanding of the disease called lipedema. This disease is found predominantly in women, and it is a loose connective tissue disease consisting of diseased subcutaneous adipose tissue, or SAT. It is distinctly different from obesity. It's estimated that about 10 to 18% of adolescent and adult women suffer from this under-recognized disease. Lipedema fat does not reduce as expected in response to diet, exercise, or even bariatric surgery. There are specific lipedema surgery techniques that are being performed by highly trained surgeons, and they are proving to be very successful. I personally am seeing a significant jump in these women post-surgical who are requiring physical therapy long-term following their surgery. And while it's been very successful, this study is looking at non-invasive physical therapy and how it can help. So while this is a small study consisting of just 5 women, the results are incredible. This is a 6-week study that included a total of 9 physical therapy sessions. Each session is 60 minutes in length and consists of manual therapy techniques, exercise guidance for a home exercise program that is individualized to each patient, education and compression garment assessment. Manual therapy consisted of manual lymphatic drainage, as well as myofascial release techniques and negative pressure. Now, negative pressure devices are essentially cupping tools. They create an opening or a lifting of the tissue, which opens that space for fluid to move, as opposed to manual lymphatic drainage, which exerts a positive pressure onto the skin, on top of the skin. And I'm growing very fond of using this technique in my office because I'm seeing how both modalities work together, positive pressure and negative pressure, to help patients with lipedema and lymphedema. Now, the negative pressure ranged from 80 to 300 millimeters of mercury of pressure in this study, and there was a pulse and release function. Education consisted of posture education, joint protection, movement and exercise, diaphragm breathing, healthy eating, and compression recommendations. Now, each compression was different and tailored to meet the needs of the patient individually in order to prevent swelling and symptoms of leg heaviness and fatigue. This follows the guidelines that were set by the standard of care for lipedema in the United States, which I have discussed previously. Now, all of the patients in this study had lower body lipedema, and therefore the exercises addressed lower body strengthening and flexibility, as well as finding a program that would ensure long-term compliance by the patient. At the completion of the 6-week trial, results were measured in a variety of ways. First was a visual pain scale. On a scale of 0 to 10, rate your pain. So we've all heard this before. 0 is nothing, 10 is the worst pain imaginable. At the onset of the trial, average pain levels were about 5 out of 10. And the same test given at the end of the study had pain reports of 0. And all women reported that the 0 pain level was achieved by the 8th visit. Amazing. 2 other questionnaires were given looking at quality of life measures, looking at general health, pain, physical, social, and emotional functioning, and the average scores of both of these subjective tests improved significantly. Another interesting aspect of this study was the use of sodium MRI measurements. Now, this test has recently been shown to provide an objective internal marker of lipedema compared with BMI-matched females without lipedema. So higher tissue sodium levels are indicative of lipedema, and sodium is stated to be a hallmark biomarker for inflammation, and therefore elevated sodium is associated with leg pain due to lipedema. At the end of the study, there were improvements in both skin and tissue sodium levels. So the results of this study clearly show the benefit of offering a conservative physical therapy program to reduce pain and improve function in women with lipedema. I agree that any woman or man suffering should try PT before considering surgical intervention. While the small study size is a limiting factor of this study, I believe it is a clear indication that more studies will be done in the future and should be done in the future. My name is Lisa Berman Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to make us all lymph smart.